Welcome back at 8:15. So asthma and allergy sufferers and their parents know that these chronic conditions can cause more than just a stuffy nose or other types of reactions. We often don't discuss the psychological toll. Dr. Reena Mehta from Uptown Allergy and Asthma joins us to discuss the mental impacts that you were just telling me, and I never even considered this until I found out we were doing this subject here today, how common this would be. And you were just saying you just had a situation just earlier this week or last week about a patient. And tell us that story if you can.
You know, so I see this on a regular basis where you have people who feel uncomfortable with their allergies. So I'm thinking about a patient with eczema. Eczema is a very common thing. And so this patient that I saw a couple weeks ago was basically saying, you know, I'm uncomfortable in my own skin. I don't like to go places because I'm worried about how people might look at me, might judge me. She said when she was a teen, a pool party was her worst nightmare.
Wow.
So, you know, that feeling of just, I'm not myself, I can't go out and be who I am in my own skin is very isolating.
And then for people who have asthma or allergies, that's a whole nother layer of just stress and anxiety for the patient. And then if they're a minor or even not, for their parents.
Absolutely. A food allergy parent is anxious, right? They send their kid to school. They're not there. They don't know what's going to happen in an environment where they're not present. And it's terrifying. You just don't know what, and you know, these reactions can happen so quickly. So the anxiety behind that is real. It is real, and it really takes a mental health burden. So
prior to our discussion, we, and probably people at home, thought, you know, you're just treating people with allergies and asthma. But you were telling me just now, you're also having to recommend other doctors, other specialists to your patients because they're dealing with these feelings.
Absolutely. You know, having them have a good therapist or a psychologist to discuss the anxiety behind this. We try to do a lot in our clinic as well. So like, for example, food allergy patients who are so anxious to even be next to that food. We do a lot of exposure therapy, like proximity challenges. So if you're allergic to fish, for example, and we put it next to you as a proximity challenge, that makes you recognize that, okay, I don't have to be scared anymore. This can be next to me and nothing is going to happen. And we do it in a monitored setting so that, you know, that patient can feel comfortable that if something were to happen, my doctor's right there to support me.
There are a lot of patients, parents at home right now who have allergies, have kids with allergies. What's the biggest piece of advice you'd give them to best cope with the anxiety that comes from dealing with these allergies or asthma, or both? Some people have both. So what's your biggest piece of advice for these people?
I mean, I think having a doctor who understands the impact that this can have, because there are a lot of things we can do now treatment-wise. And so if I have a patient with severe eczema, I have the tools to make it better. Right. And often if I can fix their skin, they are so much happier. It changes their quality of life. They even will say things like, you saved my life, because, you know, they are upset and they are having these issues on a regular basis. And suddenly when they feel comfortable in their own skin, it's like a different person. And so I think having that support group is really important, not only your doctor, but also surrounding yourselves with people that you trust, your friends, your family, people who know what some of your limitations may be, because then it's a much more supportive environment where you feel comfortable.
Dr. Mehta, thank you for joining us for this conversation this morning that I hope made people at home who understand feel seen and feel heard. We appreciate your time this morning.
Thank you for having me.